San Diego 6 News in the morning. Your station for balanced news.
And later, we discuss the impact of the president's health care reform plan. We'll have the latest on local industries. Health insurance insider Craig Gussin will join us in studio next, right here on San Diego 6 in the morning. All right, let's break this down at least as much as we can in the area of insurance and the insurance companies, which, of course, as you hear, there are the culprits right now in the latest argument. Craig Gussin joins us again this morning with Auerbach and Gussin Insurance and Financial Services. You know, one of the first things my boss asked me after one of our segments, she says, well, now Craig works for the insurance industry. Why would he not just be a homer for the insurance industry and just, giving us everything from their point of view, biased in that direction?
My job is I actually work with the consumer. My job is to help the consumer find a plan that's going to meet their needs. The insurance companies, yes, they pay us, but really my goal is I educate the consumer on how to get health insurance, and every insurance broker does it.
So you're a broker. You don't work for a healthcare insurance company. You're trying to find the best policies out there for each individual.
Yes.
Okay, are there policies out there now that meet the vast majority of people's needs, or do we have a big gap here in California and the rest of the country in terms of what's being offered, what's available to people in terms of healthcare insurance?
In California, we have 129 individual plans that are available to consumers. For group insurance, there are about 6 major group health insurance companies. Each one offers somewhere between 20 to 35 plans. There are choices for everybody, from a basic plan that gives you a couple doctor visits to total coverage that you would walk in, have your surgery, and walk out and pay nothing.
So there's catastrophic coverage for maybe young people that think I just don't go to the doctor that much. Are they affordable, though?
Yes, we have a plan that came out, 3 doctor visits a year, $30 each. Then you have a deductible of $500, then you pay 30%. Your max out of pocket, including your deductible, is $3,000. Generic only prescriptions, because they're really not using them. And it probably runs about $100 a month.
About $100 a month, you think that an individual, a healthy young individual that doesn't go to the doctor that much can get a comprehensive plan that would cover them if they should become seriously ill or injured.
Right.
Okay, well, let's talk about why then the insurance industry is made out to be such the culprit right now. Is that industry just the scapegoat while the president tries to push his plan, or are there some real shortcomings in the insurance industry?
Well, you noticed in the beginning the name was Health Care Reform. That wasn't really working, so they changed the name to Health Insurance Reform, because you got to pick on somebody, and you're either going to pick on right now either the Republicans or the insurance companies. So the insurance companies are a great way to go after somebody. You need to have a scapegoat to go after. The insurance companies go, you know what, you're making all this money, but the insurance company's goal is to finance America's health care. That's what they do. They're just paying the bills that are out there. Your surgery was paid for by the insurance company. Well, if nobody has talked about controlling cost. So 5 years from now, the surgery you have is going to be a lot more money, because the hospital you have is going to charge more money for it. The physical therapy you go to is going to charge more money for it. The insurance company is going to be paying that, so they're going to have to charge more money to pay for that.
The day that I hurt my knee, the combination of the emergency room visit and the trip to the hospital cost over $5,000.
And of that, you paid?
Nothing.
Nothing.
Because my insurance company paid for it.
Exactly.
Okay.
So if you had to pay half of it, your insurance premiums would probably be what, half, 3/4, of what you pay for.
Okay, so let's understand that there probably are some issues in the insurance industry that some people feel that are legitimate, but talk to me about what you just did in Washington. You just got back from Washington.
I literally got back last night.
Who did you talk to?
We were very fortunate. Scott Brown, the senator from Massachusetts, spoke.
This is the guy widely credited with putting the brakes on this health care reform without it getting slammed through.
Right. He spoke. Also, Senator Ben Nelson, a Democrat from Nebraska, who did the Cornhusker deal, he spoke.
And this is a guy that he got the rest of the nation to subsidize his Medicare payments in Nebraska in return for his vote.
And everybody that spoke there, Democrat or Republican, all said the same thing. We want health care reform. We got to control costs, because the bill doesn't really control costs. And it pretty much, you could not tell a Democrat from a Republican on what they were talking about. And when
So why can't they get together?
Because the question comes down to the president wants this bill passed now. And the question is, why now? Why now when we have so many jobs? That really is the big issue right now. every year the National Association of Health Underwriters, which is what most brokers that sell health insurance belong to, they have a meeting in Washington. The timing just happened to be right now, which couldn't have been a better time. And there were 700 people from across the country that came there for this meeting. And pretty much all we heard was, you know, we all want healthcare reform. I've been saying for 10 years, I want to cover everybody in California. I don't care. I want to get rid of pre-existing conditions. We're fine doing that. But if people aren't going to get health insurance and aren't going to have any financial incentive in the game, then the insurance companies' rates have to go higher and higher because you're going to have less people, you know, paying for more of the insurance.
Okay. Craig, as always, it's a pleasure. You've given me this National Association of Healthcare Underwriters information that you delivered to the legislators in Washington. I'm going to look through it, study it, and educate myself a little bit more. And I hope the American people will continue to do the same. Study the issues. It's great to see you. Thanks for coming in, as always. All right, for more information, you go to san diego6.com and you click on Hot Topics.